Good afternoon, dear students. We continue to learn the discipline diseases of the hard tissues of the tooth. And today is the first lecture of the section Pulpitis. My name is Tamara Dubrovina Parus. I'm a senior lecturer of Dentistry and Orthodontics department. So let's start today's lecture. The topic is anatomical and physiological features of the pulp. Blood supply, innervation, aging changes, etiology and pathogenesis of pulpitis, classification. Inflammation of the tooth pulp in the practice of a dentist therapist occurs in 14–20% of patients. Knowledge of anatomical and physiological features and the ability to competently assess the functionality of the pulp will allow you to choose an adequate method of treatment. And let's remember just 3 words about anatomy of the tooth. You see the cut of the tooth where the letter E means enamel, D means dentin of the tooth, also crown pulp and root pulp. And the next picture shows you the apical third of the root. You see in this picture also see the pulp, periodontal ligament and the alveolar bone. And on the next picture, you see the apical delta of the pulp. This picture is the longitudinal section of the lower molar and premolar, showing additional channels and apical foramens of the tooth. It is additional channel and foraminal apex. Additional channel, apical foramen. Let's learn the pulp layers. They are odontoblastic, subodontoblastic, which continue the outer zone and the inner zone, and the central layer. Let's learn the structure of the pulp. It is odontoblastic layer. The next is cell-poor layer, cell-rich layer, and the central layer or core or the pulp. And histological structure of the pulp-dentin complex. It is dentin, next layer predentin, the layer of odontoblasts, and a zone rich in cells. This histological preparation shows dentin, non-mineralized dentin, odontoblastic layer of a cell-free zone and a zone rich in cells. And let's learn about the cells of the pulp. Fibroblasts. The most numerous pulp cells located in the central layer have a stellate of fusiform shape. They are capable of producing the basic substance and collagen. Histiocytes. It is a long cells with thin branching processes located mainly in the center of the pulp, perform a protective function, phagocytize microorganisms, participate in the development of immune reaction. Dendritic cells, they are located near odontoblasts and are in the subodontoblastic layer. They have a different shape with a large number of branching processes. They are anti-aging presenting cells that induce the proliferation of T lymphocytes. Lymphocytes. A few in number, located mainly in the peripheral areas of the pulp, their number increases with inflammation. Small T and B lymphocytes, plasma cells. The pulp also contains eosinophils and mast cells. Pulp fibers. Collagen fibers are located in the crown part in the form of a network, more dense at the periphery and loose in the center. Fibers from bundles in the root canal. Reticulin and agarinophilic in the form of a mesh throughout the pulp, penetrate between odontoblasts, can turn into collagen. Oxytolin fibers do not have a strict orientation, are more numerous in the peripheral part of the pulp, and are connected to blood vessels. Some pass between odontoblasts. Intercellular substance. It is a gelatinous substance, gives the pulp a shape. The liquid colloidal system contains high concentration of JAK, proteoliglycans, chondroitin sulfate, heparin sulfate, hyaluronic acid, fibronectin, water. Provides metabolism in pulp cells and tissues. Protects pulp cells and vessels. Pulp blood supply. The arterioles entering the apical opening are divided into procapillaries. Capillaries depart from them and form a capillary network, especially well developed in the intermediate layer of the pulp and penetrate into the layer of odontoblasts. From the capillaries, blood flows through the postcapillaries into small venules and then into larger ones. You see the microangiography of pulp vessels. This photo shows a central vascular bundle and a branched capillary network, especially pronounced in the subodontoblastic and odontoblastic layers. And the next picture shows you a pulp microvessels. And the next information I want to tell you about pulp innervation. In the peripheral areas of the pulp, most of fibers lose their myelin shed, branch and form the subodontoblastic Rashkov nerve plexus. Nerve fibers that entwine odontoblasts and terminate at the border of dentin and pulp depart from it. Irritation of these receptors causes pain. Sympathetic and parasympathetic fibers regulate blood circulation. Pulp functions. The first function is dentin formation or plastic function. Next is protective function, trophic, and sensory or receptor function. In this case, you see the tooth cut with a deep caries cavity, deposition of a large amount of secondary dentin, a pronounced inflammatory reaction in the pulp. And what about pulp properties? They are adaptive, absorption capacity, immune, and reactive property. The period of the functional matter reformation of the pulp is the period of formation of the tooth root. The period of functional maturity of the pulp is the period of a fully formed tooth root. The layer of odontoblasts is compact. They are reduced in size. The cells of the central layer are more rounded. Their number is decreased. In the crown pulp, secondary dentin produced by a pear-shaped odontoblast is provided with tubules without radial direction in the root pulp. Secondary dentin is not channeled at all. And you see the formation of the root apex. Letter A shows a stage of the uniformed apex. Letter B shows the stage of the unclosed tip, and letter C shows us a mature apex, two channels. The period of decrease in functional activity is the period of the common signs of tooth aging. The tops of the pulp horns flatten, the volume of the tooth cavity decreases while maintaining the basic configuration. A distinctive age sign is narrowing of the lumen of the dentin tubules, narrowing of the mouth of the root canals. The number of fibroblasts decreases, fibrocytes of a characteristic fusiform shape appear. Dystrophic changes in cells occur in 60-75 years. Amorphous collagen is formed, sclerosis, mineralization of the main substance, cell-free ossification. Age-related changes in the pulp. On this picture, you see reducing the size of the tooth cavity, changing its shape, decrease in the number of cells, increase in collagen fibers, calcification of tissue. As example, I show you pictures of a crown pulp of the incisor of a 71-year-old patient. There is a significant amount of a secondary dentin. There is no odontoblastic layer. The pulp is practically devoid of cellular elements. And on the next picture, root pulp with a high fiber content, almost without cellular elements. And the next we learn will be etiology of pulpitis. They are microorganisms and products of their activity, mechanical factors, physical factors, chemical factors, and metabolic disorders in the pulp. This picture shows you microorganisms and products of their vital activity. First, histological picture shows a carious lesion complicated by inflammation of the pulp. And the next is permeability, marginal or micro leakage. Next picture is a tooth cut with an enamel dentin crack. You see this crack? And it goes at an angle to the dental tubes and is filled with dental plaque. The dentin tubes are filled with microorganisms. Next will be traumatic factors. They can be through the fault of the patient, tooth dislocation or fracture, and through the fault of the doctor. Pulp injury can be during preparation or drying and gidation of dentin, or if it is metal fillings with high thermal conductivity. Or maybe it will be orthodontic displacement, tension of the neurovascular bundle, rupture of blood vessels with subsequent ischemic necrosis of the pulp. Physical factor: ultrasound, radiation, exposure, vibration. And chemical factors: toxic effect of drugs for antiseptic treatment of the caries cavity, etching, components of adhesive systems, composite materials without appropriate pulp isolation, the use of therapeutic pests, the introduction of irritating drugs into the dental pocket. Metabolic disorders, denticles and petrification in the pulp. You see the large deposits of secondary dentin, denticles in the tooth cavity, and the arrow marks of the blood vessels in the thickness of the secondary dentin. Pathogenesis of pulpitis. As a result of the alteration and decomposition of lysozymes, a large number of hydrolytic enzymes, glycolysis enzymes, lipolysis are released. Hydrolysis processes are activated. Organic acids of the Krebs cycle, fatty acids, lactic acid are released. The pulp is saturated with hydrogen ions, which leads to increase in osmotic pressure. Short-term narrowing of arterioles, then their expansion, as well as capillaries and venules. Increased blood intracapillary pressure. Blood thickening, swelling of shaped elements and vessel walls in an acidic environment. Increased blood coagulation, thrombosis. Edema as a result of increased capillary pressure and increased vascular permeability. You see the histological preparation of pulp hyperemia. And this slide shows you the infiltration of tooth pulp by neutrophils in response to external influences. Granulocytes dominate both inside and around blood vessels. You see it on this picture. It is blood vessel and granulocytes dominate around this vessel. Accumulation of inflammatory cells in the area of the pulp horn. This histological preparation shows you a large accumulation of inflammatory cells in the crown pulp with a slight melting of the tissue. The empty spaces, you see these empty spaces, layer micronecrosis with accumulation of pus and contain polymorphic nuclear granulocytes. This picture shows you dentin tubules. They are demineralized, expanded, and filled with bacteria. These dentin tubules, filled with microorganisms or bacteria. Neutrophil granulocytes migrating from the pulp to the dentin tubules. And you see the pathomorphological picture of chronic pulpitis. A section of pulp with lymphoid infiltration and fullness of blood vessels. The next histological preparation, it is pathomorphological picture of chronic pulpitis. You see the pulp area with pronounced interstitial edema. And the next preparation is hypertrophic pulpitis. You see the hypertrophic of the pulp. And it is the clinical situation. You see the hypertrophic pulpitis, which grows from the tooth cavity. Just about few words about exacerbation of chronic pulpitis. It is observed when drainage is difficult, which leads to the accumulation of inflammatory products in the tooth cavity and increase of pressure in it. Evaluation of the tissue trophic and the development of new abscesses. Hyperthermia, acute respiratory viral infections, and other diseases can lead to an exacerbation. It is mainly connected with the virulence of microorganisms, the duration of the action of stimuli, the primary localization of inflammatory process, the resistance of the pulp, and the protective properties of the organism. The pathological process in sensitized people develops faster and goes harder. You see the classification of pulpitis developed by Professors Yavorska and Urbanovich. They divided all pulpitis into four groups: acute pulpitis, chronic pulpitis, and aggravated chronic pulpitis, and the fourth group, pulpitis complicated by periodontitis. And acute pulpitis, they divided into different forms. The first form is hyperemia of the pulp, limited or local pulpitis, diffuse or serous pulpitis, purulent pulpitis, or pulpitis caused traumatic factors, traumatic pulpitis. Accidentally exposed pulp and tooth fracture with pulp exposure. And the chronic forms of pulpitis divided into fibrous, hypertrophic, gangrenous, concrementous. And I'll tell you previously that the next group is aggravated chronic pulpitis and pulpitis complicated by periodontitis. Here you can see the classification of pulpitis developed by International Classification of Diseases, ICD-10. And you see different codes according to different diagnoses of the pulp. I think I'll give you just a few minutes. You can write this classification in your notebooks. It is the next one and the next codes of different forms of pulpitis. And I also give you just a few minutes to write down to your notes. So guys, for today that's all, and I hope this material was useful and understandable for you. Have a good day and see you at our classes.